It is estimated that 20% of the world's population suffer from chronic acid reflux disease. There is nothing worse than enjoying a plate of food and then shortly after you finish eating it, there is a burning feeling in your esophagus. Some of the foods you are eating might be the cause of this. Welcome back. In this video, we'll take a closer look at the foods to avoid or limit if you have acid reflux. Most of the food and beverages we are going to talk about will come from these three articles. Number 1, risk factors for gastroesophageal reflux disease symptoms related to lifestyle and diet. Article 2, risk factors for gastroesophageal reflux disease, role of diet. And Article 3, foods inducing typical gastroesophageal reflux disease symptoms in Korea. First off, what is gastroesophageal reflux disease or GERD? It is a chronic form of acid reflux that occurs more frequently than regular heartburn, a condition involving the lower esophageal sphincter, LES, weakness and inappropriate opening leading to reflux of gastric content into the esophagus. Usually, the LES muscle closes tightly after you eat or drink. That prevents stomach acid from backing up into your esophagus. In GERD, the sphincter muscle doesn't close tightly, so acid escapes from your stomach and gets into the esophagus. Some foods can worsen acid reflux symptoms by decreasing the tone of the valve that separates the esophagus from the stomach and delay the digestive process, letting food sit in the stomach longer, which triggers more acid production. Some symptoms of GERD include burning in the middle of the chest or throat, stomach contents coming up into your throat or mouth, chest pain, nausea, problem swallowing, and coughing. It's important to talk to your doctor if you have GERD symptoms because it might lead to more serious problems. However, lifestyle changes often help, and they start with your diet. Number 1 is high-fat foods. High-fat foods are some of the worst foods for acid reflux because they slow food digestion, which delays stomach emptying and cause food to sit in your stomach for longer period. The longer the food remains in your stomach, the more likely you are to experience reflux symptoms. Additionally, high-fat foods may cause your LES to relax, which allows stomach acid to leak into your esophagus more easily. That's why your heartburn symptoms might worsen after eating things like fried foods, high-fat meats, creamy sauces, high-fat dessert, processed food, and pizza. For these reasons, avoiding or limiting high-fat foods can help you avoid acid reflux symptoms. Number 2 is acidic fruits and vegetables. While fruits and vegetables are a key part of a healthy, well-balanced diet, certain types might make your GERD symptoms worse. The following fruits and vegetables commonly lead to acid reflux. Citrus fruits, including oranges, grapefruits, lemons, and limes, are high acidic fruits. Avoid these fruits and their juices if you suffer from acid reflux. Also, pineapple and kiwi are high acid fruits that are beneficial to limit in order to manage your acid reflux. Lastly, tomatoes and tomato products are packed with malic and citric acid. These acids can make the stomach produce too much gastric acid and worsen acid reflux. Cooking tomatoes won't reduce the acidity enough to prevent acid reflux, so try to limit or eliminate tomatoes from your diet. Number 3 is garlic and onions. Onions are a common reflux trigger food, and the sharper the onion, the worse it is for acid reflux. This is due to high sulfur content of some onions, which increase gastric acid and relax the lower esophageal sphincter. When it comes to acid reflux, not all onions are the same. If an onion makes you cry when you cut it, it is too strong. Sharp onions are worse than sweet ones, and raw onions are far worse than cooked ones. Also, many people report garlic as a trigger for acid reflux symptoms. Try using other herbs and spices to increase the flavor of your meals without causing heartburn. Onion evidence comes from this article, the effect of raw onions on acid reflux symptoms. Number 4 is spicy food. Spicy food contain capsaicin, the compound that makes food spicy, and can irritate the esophagus, causing pain, burning, and stimulate the stomach, causing increased acid production. Also, spicy food can slow down rate of digestion, leading to delayed gastric emptying. If you suffer from acid reflux, try sticking to mild or lightly seasoned food. Number 5 is mint. While mint may seem like a soothing flavor, it also often triggers acid reflux because it relaxes the muscles in your esophagus, including the sphincter. So acid and other food remnants can flow back into the esophagus, worsening acid reflux. Unfortunately, this includes anything mint flavored such as tea, gum, and candy. If you're finding this information useful at all, Please hit the like, subscribe button and turn your notification on to stay updated with my latest health-related tips. Number 6 is caffeine. Caffeine in tea, soft drinks, coffee, and energy drinks can worsen symptoms of acid reflux by stimulating your stomach to secrete more acid and causing relaxation of the lower esophageal sphincter. Number 7 is chocolate. Both milk and dark chocolate are common trigger for acid reflux. They contain caffeine and theobromine, which has been shown to relax the smooth muscles of the lower esophageal sphincter, which contributes to acid reflux symptoms. Cocoa also increases serotonin levels in your stomach, which causes lower esophageal sphincter relaxation and worsens acid reflux symptoms. Chocolate evidence comes from this article, Chocolate and Heartburn, Evidence of Increased Esophageal Acid Exposure After Chocolate Ingestion. Number 8 is alcohol. Alcoholic drinks has 2 negative effects for people with acid reflux. First, it relaxes your lower esophageal sphincter, leading to more reflux. And second, it stimulates stomach acid production, which increases the quantity of acid in your stomach. This makes it a common trigger for acid reflux, and it is best to avoid it or drink in moderation. Additionally, alcohol is known to irritate your digestive tract and increases inflammation in your gut. Number 9 is carbonated drink. The air bubbles in carbonated drinks can cause your stomach to become distended, increasing pressure on the esophageal sphincter, causing lower esophageal sphincter to open inappropriately, which leads to acid reflux. Alcoholic and carbonated drinks evidence come from this article, Association between beverage intake and incidence of gastroesophageal reflux symptoms. Remember, moderation is key with all the foods and drinks that we have discussed today, especially if you may not be able to or want to completely eliminate these foods. Also, try to avoid eating trigger foods late in the evening closer to bedtime, so they're not sitting in your stomach and then coming up your esophagus when you lay down at night. It's also a good idea to eat small frequent meals instead of bigger, heavier meals, and avoid late night dinners and bedtime snacks. If these have been helpful, hit that like button and be sure to subscribe for more health related videos. Until next time, stay healthy and remember, health is the greatest wealth.